With Bell, Let's Talk Day here upon us, the number of initiatives you've been involved in when it comes to mental health. Why did you get involved in the first place?
My wife and I were always involved with cancer stuff. Two of my good friends had lost their sons to brain tumors, and so that was our initiative. And then one summer in Saskatchewan, near our lake home, two lives, young man about 21, and then a father, both lost their lives. One was killed by his son because of mental health, and one stepped out of a moving vehicle because of mental health. And when I went to Jordan Church's funeral, his dad grabbed me and said, "Mike, you got to do something here." So that day, I phoned a friend of mine, Dr. Dee Maltman, and he said, "We got to do something, need some help." That same time, I phoned Michael Landsberg and started, I guess, learning something about mental health. But obviously, it affects 1 in 5 Canadians. So that means if you think of my hockey club, there's got to be 4 guys at least affected by it. I'm real blessed in my own family. No one at this time is affected by it, but it's a scary, scary thing.
So does it change your perspective? Do you see things through a different lens after what happened, and then you go back to the first training camp after that summer?
Well, there's no question you do. I've coached a long time in the league, and very few players have ever come to me about mental health. Now, a few have. So there's still a stigma. It doesn't matter what you say. There's nothing worse when you say something and when you're reaching and you're trying to reach out of your mouth to pull the words back because you've been a jackass. What I think you do is you learn to speak better, to see better, and understand what's going on. And then I can tell you for sure you're way more careful with your own kids and their friends. And this is a conversation, I don't want to say daily in our house, but a lot of time in our house. I've had people I've talked to over and over again. People have reached out to me and say, "Hey, can you talk to this gentleman? They got a great job, they got a great family, and then suddenly they're not alive anymore." Well, that's absolutely tragic.
It seems like in a lot of areas over the last number of years, the awareness around mental health has grown substantially. How far has that conversation come then in, say, an NHL dressing room?
Well, I think it's come a long way. Does that mean one of your players is coming to you? No. But what it might mean is one of your players might be going to one of the guys on the medical staff and saying, "Hey, I need a doc," or maybe they're going to their team doc. I think when you sit down and talk to people, and if you're in my shoes and you don't confuse the player and the person. So, for example, you play last night and one guy doesn't get to play as much. He's mad. The coach doesn't like me. That has nothing to do with like or dislike. That has to do with you played good or didn't play good. That's the player. But the person is someone you care about and care about deeply, and you try to make better. I think it's important to send that message.
What's stood out as far as the best way to approach, in your mind, just this conversation around mental health, whether it's someone coming to you or just having the conversation about better educating others?
Just talking about it. You know, I really believe that anybody who's suffering, they want someone to talk to. Whether a player sees one of these interviews, whether a player hears that you're involved, they're, I believe, more likely to come to you just because they know you're involved in it. You might be sitting there someday and just get talking. If you can touch one person, if you can get one person to reach out and get help and save a life in any way or make a life better, to me it's all worth it. Feeling good about yourself, being in relationships with other people, having a great family, to me in the end that's what gives you strength. Not necessarily winning hockey games at night.